Hi, my name is Saba Azam. I'm a third-year pharmacy student here at UConn School of Pharmacy. I'm working with Dr. Jennifer Gerardo, Clinical Associate Professor, as well as the coordinator for the Pediatric Pharmacy track here at the school. Today I will be discussing management of viral pediatric gastroenteritis. Gastroenteritis is also referred to as the stomach flu. It's caused by inflammation in the stomach as well as the small and large intestines, in this case due to a viral infection. More common symptoms include diarrhea, vomiting, abdominal cramping, as well as nausea. In the United States, it's most commonly caused by the norovirus, peak season for which is November through April. And it's important to note that this is a highly contagious virus, so it's very easily spread. To a more severe but lesser extent, it's also caused by the rotavirus, which may cause severe dehydrating diarrhea and even death in some cases. Luckily, we do have a preventative vaccine available for the rotavirus. This is typically a self-limiting condition, and it can be effectively managed at home if symptoms are not severe. It's important to keep the child at home because the virus is most easily spread through touch, and as we know, children touch everything. So if we send them off to school, we're risking other children getting the virus. It's also spread through sneezing and spitting. Less common, but it does happen. And so while the child is at home, it's important that we promote hand washing for 15 to 30 seconds, again, to prevent the spread of gastroenteritis. Since dehydration is the most common adverse effect, it's important to both monitor and appropriately manage the child. So you want to let the child drink as much as they want. Good drink options include broth, smoothies, lightly sweetened juices, as well as water. If the child is being breastfed, it's important to keep breastfeeding the child, and additional fluid is recommended for each loose stool. So in case of diarrhea, any child under 50 to 100 mLs of additional liquid is recommended for the child after each loose stool, and children from 2 to 10 years old are recommended to have 100 to 200 mLs after each loose stool to maintain hydration. If you notice that the child is continuing to get sick, meaning they're having persistent vomiting and diarrhea, or they're not getting better on their own, it's important to contact your doctor. Here I just want to mention some common symptoms for dehydration, which may include increased thirst, dry tongue and lips, crankiness, or drowsiness and dizziness in the child. In terms of treatment for the dehydration, the provider may suggest an oral rehydration solution, such as Pedialyte, Infalite, or Kinderlite. And these contain the right mix of salt, sugar, as well as minerals to keep the child hydrated. It's very important to consult with the provider on both how much and how quickly to give the solution to the child. Additionally, depending on the cause of the gastroenteritis, the doctor may be able to provide medication to stop the vomiting. So like I said, it's very, very important to reach out to the provider if you notice that the child is not getting better. Many times, if the child is able to stay hydrated, they can remain at home without any additional medications. However, it's very important to monitor this child. Please seek help immediately if you notice any additional symptoms, such as a high fever or severe abdominal pain. If symptoms persist longer than 3 days, it's also important to call a doctor. You want a doctor consultation at this point. If you have any additional questions, you can reach out to me in the email provided in the description. Again, thank you so much for watching, and I hope this was helpful.